£260 million has been made available to help the NHS go digital by 2018. The Health Secretary, Jeremy Hunt, says the money will be used to develop electronic prescribing to help cut down on the number of prescription blunders.
Last year, tragically, more than 40 people died in the NHS because they were given the wrong medicines. And there is evidence that if you do things electronically, you can prevent between 20 and 30% of wrong prescriptions. So it's a really important thing for patient safety. But it's also important for doctors and nurses because what they want to do is spend more time with patients at the bedside, not having to fill out endless paperwork. And if you have a proper computer system, it means you only have to put that information in once and it's properly stored there. So I think it'll make a big difference for patients.
Well, Sky's James Banks has been seeing how the system works at Kings College Hospital in London.
Well, here at King's College Hospital, they are early adopters of this new technology. If you take a look behind me, you'll see that there aren't any clipboards on the end of the beds. That's because the nurses use iPod touches to collect the patient's data, so vital signs such as blood pressure and temperature. That data is then held centrally on the cow, the computer on wheels. I'll now bring in Dr. Barker. Doctor, how important is this change and has it changed the way you work?
Yeah, this is vital to us. We've got all the patients' letters and documents on the system so that whenever they come to the hospital we can see everything that we need to know about them. We've got all the blood test results there that are going back several years, so we can at a glance see what's happening. You mentioned the blood pressure and pulse, and that's all on the system, so we can see a chart of the patient on the system. And I can see that from my office, I can see it from the ward, I can even see it from at home, so I can very easily take an overview of what's going on with my patients and try to make sure they're safe.
So efficiency for the hospital staff, but also added safety for the patients?
Absolutely, yeah. We can see very easily which patients are deteriorating, whose blood pressure is changing, whose temperature is going up, and all sorts of things at an instant.
Dr. Barker, thank you very much. This new technology, though, isn't just about emails and iPod touches. It's also about having a robot downstairs in the pharmacy who picks the drugs out. I must stress, though, there is a set of human eyes that does have a look at the drugs before they do reach the patient. But essentially, this news that's come out today, this £260 million investment, does mean that hospitals such as King's College Hospital here in London will become more efficient and patient safety should be increased. And it's just part of an initiative by the government to try and fully digitise the NHS by 2018.
James Banks there.